Health Department has raised concerns about the slowing number of COVID-19 vaccinations in the country. This will likely lead government to open up the process for 18 to 34-year-olds much sooner than anticipated. For more on how the country can get its inoculation drive back on track, we're joined by Wits School of Governance's Professor Alex van der Heever, the South African Medical Association Chairperson, Dr. Angelique Coetzeea, and the Progressive Health Forum convenor, Dr. Aslam Dasoo. Good evening to all of you, and thank you so much for your time tonight. The vaccination program seems to have hit a snag, and there are really a multiplicity of challenges that government is facing in terms of its rollout. Professor Coetzeea, when you look at just the numbers in terms of people that are coming to get vaccinated, whether it's the age differences, whether it's the gender differences, what do you point out as the biggest issue right now?
Thank you, Kathy. I'm just an ordinary GP, but what we are seeing is lack of communication, proper communication. What we are doing is we tend to communicate to the people out there in the language that we as medical practitioners are used to, but forgetting that should speak to the people on the ground, and we need to speak the language of the people on the ground, not only meaning the indigenous languages, but also getting the message out in a very, very simplistic way. With a lot of the interviews I had and the questions coming to me, it is very simple questions. It's questions like, why should I get the vaccine if I can still get COVID-19? Why should I get the vaccine if I still have to wear my mask? Why do I need to get the vaccine if I'm still going to end up in hospital? It's valid questions that the average person out there are asking, and we're not answering them. So that's one of the things is, and then important, the vaccines should go to the patients, the people. It's difficult when the people needs to go to the vaccines, and we have seen that the EVDS system doesn't get the patients to the closest center to them. We need to understand that there are people who have to travel. It's costing them money to get vaccinated, and we need to make sure, again, that the centers allocated to them are close to them, most appropriate, and then again, where you can take the vaccines to the people.
Dr. Dasoo, Dr. Coetzeea speaks about the problem of communication. And if the Sunday papers were anything to go by, I think the Sunday Times running a story this past Sunday just about how the health department has exhausted all funds to invest in any kind of communication campaign. So in the absence of very targeted communications and campaigns, how else do we increase the rate of the vaccination?
Yes, good evening, Kathy. Look, I think the drop-off in vaccination brings up these questions very pointedly. We've been saying for months now that the communication strategy needs to be more targeted, and I think Dr. Coetzeea has outlined exactly why, and in what way it should be targeted. You've got to speak to the people in the idiom to which they're accustomed, and they need to hear it from trusted community sources, such as your teachers, nurses who live in communities, traditional healers, and so on, who will be able, if they were enlisted into the effort, do a lot for communicating. I think the second problem is the way the vaccination program is being rolled out. It's very corporatist. It's, we went in the way we decided to go with the facilities we have, public and private, and pharmacies and so on. But unfortunately, this is not necessarily conducive to getting the masses of people there. I think the middle classes find it easy to get to these facilities. But as Dr. Coetzeea also pointed out, there's a cost to it. And the third thing is that I think people misunderstood. Whenever this age de-escalation program has shown a pattern, and it was a predictable pattern. You would get a high take-up initially, and then it would drop off. And that's precisely what's happening now. This age de-escalation system should have been dropped a while ago. I'm really pleased to have heard the Minister of Health saying that the over 18-year-olds will be starting vaccination this week and not on the 1st of September, which means that every adult in the country now is eligible for a vaccine. But importantly, because the most number of admissions are in the higher age groups, the over 60s, those with comorbidities, a new and dedicated effort to reach them. I think we've only reached about 70% of our over 60s. So the remaining unvaccinated cohort is contributing hugely to admissions. And so that needs to be targeted. I think the government, yes, they can complain now that the resources for communication are no longer available. And, there'll be a lot of stories about that, but I don't want to go into that. Even Business for South Africa, which works with the government, has a huge communication portfolio. But I'm not sure that it's reaching its intended targets. In any event, we are now way below our expected vaccination targets, and there has to be a step change. I think when the over 18s start coming, we might see the numbers go up initially, and then, as expected, they will taper off again. So we need to deal with that. We also need to deal, of course, with the other causes of vaccine hesitancy as they arise. And I'm not just talking about the anti-vaxxers, I'm talking again about what Dr. Coetzeea said, about simple issues that people are just not certain about because they haven't had the requisite information and knowledge about it. So these are the main issues, I think.
Professor van der Heever, when we have this conversation about moving the age groups and the access to a younger age group, what also happens is that if you look at some of the research and the studies that have been done around the vaccines, you do have quite a high levels of hesitancy amongst the age group of 18 to 34. How can things be done differently this time around to ensure that when they are able to get vaccinated, you do have a greater uptake than perhaps what we have seen in the other age groups?
So I think that what we've been facing, and that probably hasn't been totally anticipated in this campaign, in this process, is that there has been a very assertive and coordinated campaign to actually make people hesitant about being vaccinated. And this adds another dimension to the communication process because it raises questions in people's minds about who to trust in the vaccination process. And this can hit certain demographic groups more than others. We've seen it in the recent HSRC survey, as we see, for instance, a high level of hesitancy amongst whites for some reason, and we see that there will be differences amongst age groups. So I think on the one hand, it's understanding where this messaging is coming from and being able to address it head on. Because I think that if we passively respond to it, a lot of people wait and see. But we're also seeing that there's a change in behavior over time. Certainly as people see people who are close to them getting infected and getting seriously ill, it changes their mind, as well as when they see that happening to friends and relatives. But the problem is you don't want to wait until then for people to come forward and get vaccinated. You want to anticipate this. And I think that this is where combining the sort of messaging resources of both government, the private sector and civil society to deal with the issue of people attempting to create hesitancy. I mean, it's a malicious part of this COVID pandemic that we see this happening, and it's clearly being orchestrated. So on the one hand, we have a relatively passive campaign providing advice and information, and we've got an active campaign about people trying to stop people from getting vaccinated. So I think that means you've got to change the degree and the level of messaging to address that, because I think that it's killing people basically.
And in terms of being able to truly address the fears and the concerns that people have, it requires health professionals actually engaging with South Africans one-on-one. How can that happen under this current climate? Dr. Coetzeea, what are some of the solutions that you would offer up to government right now?
Sure. This is very difficult, Kathy. I do on a daily basis get mails from the public asking questions, and I don't even have enough time to answer them. But the questions is always the same. So again, what Dr. Dasoo and Prof van der Heever said is we need to engage, whether we like it, whether we don't, whether we get tired of giving the same message out on a daily basis. We have to keep on doing it to make sure people are hearing us. We need to understand a lot of people doesn't want to hear what we are telling them. They want to hear a different story. Unfortunately, there is not a different story out there. We need to get the trust of the people, and as medical doctors should be able to be ethically, we should not bring our own personal views into the discussion where we are advising people or other members of the community regarding vaccines. If we differ from the current policy, and you are allowed to differ, then you need to make sure that it is based on sound medical evidence, scientific evidence, and also from a trustworthy component. You cannot just, because you believe something is right, say, therefore, it's wrong to take vaccines. The data is out there. It's very, very clear. And we need to get, again, the message out there on a daily basis. And again, it should be easy. We should allay the fears of people. If you tell me that your friend died after they had received the COVID-19 vaccines, we need to go through it. We need to make sure it's been reported, because a lot of this become anecdotal. It's not reported, and it's not reported on the right platform. And therefore, people think everyone is lying. This brings me back to trust again. There's not a lot of trust currently in the National Department of Health from the average public out there, as well as in the government of the day. Again, because of what we have experienced, of what we have seen. So please, let us prove people wrong. Let us bring the facts to the people, again, the way that people want to hear it, not the way that I would have a conversation with Dr. Dasoo or with Prof van der Heever, not in that manner. It should be a conversation that I will have with my patient who lives in the rural area to make her understand.
Let me thank you all for your time tonight. Unfortunately, we've completely run out of time for this conversation. Wits University Professor Alex van der Heever, the South African Medical Association Chairperson, Dr. Angelique Coetzeea, and the Progressive Health Forum convener, Dr. Aslam Dasoo. Thank you all for making